folks, this is Dr. Timothy Lineski with LC Rheumatology. Wanted to talk to you today about treatment of gout. So, as you know, gout is when your body produces too much uric acid. And one of the ways that you treat gout is that you have to get your uric acid level, which is a blood test that you do, less than 6. So that is one of the keys that we'll talk about. So when it comes to the treatment of gout, there's 3 different ways that you need to think about it. Number 1 is acute treatment. That's when your joint, which can be your toe or other extremities, is getting large, red, and swollen. Then there's prophylaxis. Prophylaxis means that you are treating your gout to prevent any flares to occur. And you need to do that for 6 months whenever you go on to the 3rd step of gout treatment, which is lowering your uric acid. So there are certain drugs that do this. So when we talk about, number 1, the treatment of gout, we're going to talk about lowering your uric acid level to less than 6. And right now there's primarily 3 drugs that we have. Number 1 is allopurinol, which has been around for a long period of time. Number 2 is Uric. And number 3 is an IV medicine that's called Crystexxa. Which one of these you are treated with, you'll have to talk to your doctor about. But what you have to understand when it comes to these 3 medicines is that they don't, when it comes to taking them, it does not matter how you feel. You do not stop or start your gout medicine, allopurinol, Uric, or Crystexxa based on flares of gout. So when you start these medicines, the key is that at the same time that you start them, you want to be on a prophylactic agent for the first 6 months. And really the reason is that when you start a uric acid lowering drug like allopurinol, Uric, or Crystexxa, about 35% of the time in the first few months, you're going to have a flare because these are lowering your uric acid level. And when you do that, you increase the risk of having a flare of gout. So the medicines that you can take for prophylaxis really are 3. One is colchicine. I primarily use colchicine, 1 pill a day for 6 months. Or you can use an anti-inflammatory medicine. Right now in 2020, I like to use a generic medicine called meloxicam or Mobic, and it's 1 pill per day. And then the 3rd one is using low doses of prednisone or steroids. This usually 5 milligrams per day. Now, which one of these you are taking as a prophylaxis is based on your other comorbid conditions. So if you're a diabetic, obviously you don't want to be using 5 milligrams of prednisone. If you have bad kidneys, you don't want to be using things like anti-inflammatory medicines routinely like meloxicam. And based on certain medicines, you may want to only take the colchicine, even a half a pill or 1 pill every other day. Then we talk about acute management. And this is when you start to have a large swollen toe. The key with this is that whenever you start treatment for acute management, you want to do it before your toe is big, red, swollen. You don't want to go to your doctor's office and have your toe bothering you for 3 days or a week and say, hey, can you fix this? You want to do it as quickly as possible. And if you've had a flare of gout before, you'll feel the symptoms before your toe gets red and swollen. So the medicines that you can use for this really are 3 different ones. Number 1, anti-inflammatory medicines. You can take ibuprofen, 800 milligrams, 3 times a day for 3 or 4 days. And if you take it early, you can usually abate your gout flare without requiring things like prednisone or steroids. Steroids are what you have to do whenever you have a flare and it's moved to multiple joints. Another medicine, the second one that you can take is colchicine, like we talked about. But instead of taking it one pill daily, you can take two pills both at the same time and then another pill an hour later. And now, colchicine they used to give in a fashion where you take one pill every hour until you had nausea and threw up, or he gave you diarrhea. We don't use it like that anymore, so please don't do that. The key with acute management is doing it early. And then some people, they may need something like a steroid where you'll take 20 or 40 milligrams of prednisone and then maybe take another 20 or 40 milligrams 4 hours later and then perhaps the next day. But the key for it is obviously you want to use as little as prednisone as possible, and you don't want to be on it for a long period of time just based on the side effects you can have for it. So when it comes to gout, you just don't pick one medicine. You have to think about, what do I take with an acute flare? Whenever I start a uric acid lowering medicine such as allopurinol, Uric, or Crystexxa, I want to also take a prophylactic medicine for the first 6 months, and primarily that's going to be an anti-inflammatory medicine once a day or colchicine one pill a day. You obviously need to talk to your uh, rheumatologist or internal medicine doctor about how to treat this. But no matter what, your goal is to get your uric acid level less than 6. Because once you have it less than 6 for 6 months or a year, primarily you'll not have gout flares again. So hopefully that is helpful to you, for you people that suffer from gout. When it comes to diet, really weight loss is the biggest thing. We don't use a uric acid lowering diet anymore, but if you lower your weight, and also, if you take shellfish or you eat a hot dog and you have a flare of gout the next day, well, don't do that anymore. You know which uh, which foods can aggravate you in particular. Lastly, so weight loss, and also obviously if you do alcohol and and you're an alcoholic or you're doing alcohol primarily, that can obviously increase your uric acid level. When it comes to the food source otherwise that you could reduce your uric acid level, high fructose corn syrup is our number one enemy, at least here in the U.S. If it's in a box or if it's a soda that you're drinking, those are really the bigger things that can increase your uric acid level. So again, hope this was helpful, and you all stay safe and take care. Thanks.